Hello, everybody. And you started again. Sorry, everybody. Just okay. Welcome. We're just the technical side here. Welcome everybody to this IMCO webinar that we're putting together with you today, and I want to welcome you all here. I'm a little bit of a newbie on this webinar technicality stuff, so we think we've got it all pretty sussed here. And I want to welcome you to the session that we've got today with the beautiful, lovely Claire Yee, and on the topic of how to have an easier birth without medication. The format of today is that we're going to have just the introduction at the beginning, and then have around about a 30-minute presentation that Claire's going to give us, which is going to be wonderful, and then we're going to go on to a Q&A session at the end. And look, if you look down the bottom of your screen, hopefully there should be an option there for you for Q&As and chats. And if you want to just put into the chat where you're from, and if you're a health professional, or your role, or you're pregnant and your gestation, or maybe tell us a little bit about yourselves, that would be wonderful. So let me tell you a little bit about Claire. So Claire is a mother to two, and she's an advocate for empowered, confident birthing, quite an expert on hypnobirthing. She's experienced the power of applying the simple hypnobirthing mind-body techniques with that drug-free, peaceful and calm water births for both of her babies, which is, personally, I think that's a really big deal, because often women sort of don't quite head down that track with their first, and it all can go to custard, and with their second pregnancy they're like, I'm not doing that, going through that again, and they really engage. So engaging with that first is just the easiest, best thing to do. And since the birth of her second baby in 2010, she has shared hypnobirthing tools for birth with over 1,000 expecting couples all over the world. Claire holds a degree in education. She's an accredited life coach, emotional freedom technique practitioner, and of course a hypnobirthing teacher. She uses a combination of all of these skills along with her own birthing experiences when she teaches that practical natural birth toolbox workshops all around Auckland and New Zealand, and of course online internationally. Claire's passionate about empowering parents to experience a calm connection empowerment during birth, as am I, as a midwife. And yeah, so just a big hi to our beautiful Claire. Welcome along today.
So excited to be here and to just have this time and this space to share our passions for natural empowered birth together. It's super excited. So yeah, thanks for having me.
Absolutely. And so please, as I say, if you're just joining us, if you'd like to go into the chat and just let us know whereabouts in the world you're from, and anything a little bit about you. If you're a birth practitioner, you might be a midwife or an obstetrician or a doula, or you may be a natural maternity health specialist, perhaps a homeopath or an osteopath, acupuncturist, etc., medical herbalist, or maybe you are pregnant yourself and you're a mum to be or a mum already. And yeah, so we'd love to hear about you all. So just having a look at some of them, we've got an acupuncturist has just sort of popped on board there, and midwives we're seeing, student midwives, so wonderful, and chiropractor, another midwifery student, so that's great. It's wonderful, great to have you all here. And down the bottom you'll see there's a Q&A button on the screen. So during the presentation, if you do have any questions that you would like to ask, please type them in there into the Q&A, and we'll go through those at the end of the, likely at the end of the presentation. And so welcome. And welcome to Claire, and I'll let you take over the screen.
Beautiful. Thank you, Kathy. So I'll just get that all set up now. Alrighty. That's all looking good?
Absolutely. Looks fabulous this end.
Perfect. Okay. So welcome everybody to this presentation, and I'm going to be sharing as much with you in this time as I possibly can. And then, of course, as Kathy said, you'll have that time to ask any questions at the end. So today I'm going to be sharing with you how women can have more calm, confident, and easier births through the methods of hypnobirthing, and to be able to have those comfortable births without medication. So during our time together, I'm going to explain how hypnobirthing allows women, as I've just said, to feel far less anxious and more calm and confident about birth. If I had a penny for every mum who told me that she was feeling anxious when she first comes to my classes, I'd have such a big pile. It's such a common feeling that women experience, but it's such a beautiful thing to be able to turn that anxiety around. And so often parents say, mums and dads actually will say at the end that they're feeling really excited about birth, and it's just such a joy to hear that. So that you can get the most out of our time together today, if you can just turn off any notifications and reduce distractions, so that we can really get, you can ask your wonderful questions, and we can all get the most out of our time together today. So this is for you if you're an expecting mother, and I can see that we've got one or two from the chat there. So congratulations. And if you're feeling anxious about your upcoming birthing day, just know that that's absolutely totally normal, and you really can turn that around for yourselves. And also, if you're a birthing professional and you're wanting to know more about how hypnobirthing really helps and supports families, so that you can then really support those families with this education of how hypnobirthing works. And I'm going to be sharing this presentation with you in the same language that I would share with parents in classes. I really aim to use, language that is just very everyday. So I know that for a lot of you, you will absolutely know so much about what I'm talking about, and you'll be able to see through, explain these things to parents. And then some of you might have actually heard about hypnobirthing, but not sure what it is. And when I first started teaching hypnobirthing 10 years ago, I got so many different comments from people that it's like, one couple thought it was hippo birthing. And so once you understand what it is, it sort of becomes less strange and weird and woo-woo, and it's absolutely not as out there as maybe what the name sounds like. It's really based in a lot of research, and really supports women to work with the physiology of their bodies in that, and allows them to align their mind-body connection for confidence. So whatever your motivation for joining us today, I am here to absolutely fully support you, and I'm so excited to be able to share this time with you. So Kathy's shared a lot about me already, so just a bit of, since 2010, I have taught heaps and heaps of couples around the world these hypnobirthing techniques. And the thing that I love the most is the stories that they share after they've had their babies. And of course, birth is different for everybody, but the stories that these families come back and share, they always have this underlying tone of empowerment and satisfaction, and they create such beautiful, rewarding birth experiences for themselves. No matter how their birth ended up unfolding, they've still been able to really cherish those memories. And so many times at the end of it, the women say after they've birthed, I feel like I can achieve anything. And I remember feeling like that as well after I gave birth. And it's such an amazing, beautiful way to begin your parenting journey, with that sense of, I can do anything. So that's that empowerment that is just so beautiful. Here's a little snippet of my second birthing experience with our baby Ollie. So this is after I'd learned hypnobirthing techniques. My husband there in the pool with me, midwife right there. Unwrapping the cord. There we go. So, you know, as I said, all births are different, but that was my experience, and just something I really, really treasure. So it's so dear to my heart, that experience. And, you know, bringing a baby into the world with that sense of confidence is really what's fueled my passion to share these techniques with other women. And I love this quote. So imagine what might happen if women emerged from their labor beds with a renewed sense of the strength and power of their bodies and of their capacity for ecstasy through giving birth. So if you're pregnant and you're watching this, just close your eyes for a moment and just imagine if that was how you felt after you gave birth. And as a birth professional, I know that supporting women to just feel so empowered and with the sense of, you know, ecstasy through giving birth, it's just so, so rewarding. So in the hypnobirthing classes that I share, I really teach how a woman's body is perfectly designed to birth her baby gently when she's in the optimal state of calm. So we spend most of our time really talking about how we can be in this optimal mind-body connection of calm. And that's really what hypnobirthing is all about. It's about really dropping in and turning the birthing over to the body and to the baby. And so I teach with parents how the uterus opens and moves away. And you may have heard this language. We call, instead of the word contraction, we use the word surge, or I also suggest that to use the words opening or a wave. Most commonly, though, the word surge is used. So if you hear your parents using the word surge, you'll understand that that's where it's come from, and they're talking about the contraction. But for a lot of women or parents, the word contraction really means everything's squeezing in, and then really what they'll do to match that understanding of what they think is happening, of everything squeezing in and tightening, the automatic response of thinking that something's squeezing and tightening in your body is to tense and brace yourself and hold your breath, and it's all very intense. Whereas if we know that the body is having a surge or a wave, women feel more calm and more confident to be able to let that wave ride through her body and work with it, rather than what a lot of women do is unintentionally fight against it. So that's really having that understanding of what the body's doing, and then knowing how to allow it and let it happen is just really such a beautiful way for women to work with their bodies and follow the lead of their bodies and their babies. So this calm, happy state is what we practice, or pregnant parents practice being in, and they're preparing this mind-body connection to be in their happy, calm, optimal state for birth. So they're engaging their parasympathetic nervous system, and this is where their blood and oxygen is evenly distributed throughout their bodies, digestive systems functioning optimally, and this is this rest and digest state. And also in this state, of course, during birth, this is where these muscles can draw open in harmony as they're designed to do. And then in this calm state, there is the release of course, all our wonderful, happy, calm hormones. And part of that are our endorphins. And endorphins have been found to be up to 200 times more effective than morphine at blocking a woman's experience of pain during birth. And just, you know, they function like that in any time, but what a wonderful gift that our body naturally gives us during birth is these endorphins. And then of course the oxytocin as well, making women feel, you know, if they feel really safe, then all of these wonderful, happy, calm birthing hormones are released, allowing the experience to be really so beautiful for them. So it's a cyclical process. We have calm in the mind, which leads to the relaxed body and the release of the endorphins. And then it allows for an easier birth because those muscles of the uterus are allowed to open and move away and work in harmony. And then, you know, once a woman's experienced that ease with the working of her body, with those surges, it allows her mind to be calm and positive anticipation of then the next surge. And so she moves into body, and it's the way, with all of these three things in place, it's the way she's really able to navigate and move through the birthing process with the sense of calm and confidence. And it's really beautiful as well for birth partners. I always encourage for birth partners, whether that's, you know, dad or husband or partner or best friend or mother, you know, sister, whoever, for mums to bring along their birth partners so that everybody can understand what the body's doing, how the body's perfectly designed, and the importance of being in this optimal aligned state for birth. And what I often get after the question I often get after people have, you know, I've shared, well, this is the body's perfect design for birth, there's always that question of, well, why isn't it so easy and pain-free for everybody? Because if our body's perfectly designed for birth, then why can't we all have a really beautiful experience in birth? And so then we talk about how fear in the mind shifts our whole physical way of experiencing birth. And it's because it leads to this tension in the body, and then we get muscles pulling against each other. So when we're in the state of fear, that's our body's natural way, or the body, when the mind is in fear, the body responds with the self-protection mode. And so when we go into that state of fear, and of course, you know, our body's naturally designed to go into this defense mode. And what happens is in this fight, flight, freeze mode, blood and oxygen is redirected away from the parts of the body that aren't part of our defense mechanism to the head for quick thinking and very focused thinking as well. When people describe what their mind is like in this fear state, it's very much just one track. And that's because we're not wanting to be distracted by Facebook when we're trying to save our lives. So we're just very focused. And then when that tension comes into the body, then these muscles are prevented from really opening in the way that they're designed, because the body's got that innate function of protecting the baby, of holding the baby in. And we see this with animals in nature as well. If a threat to the mother animal comes along as she's birthing, her body will shut down the birth so that she's able to either fight and protect herself or flee. And humans are the same. We have that same defense mode. But so the fear response is really designed and for us to protect our lives and protect us from any danger. And that's where you can see these muscles of the uterus. There's 3 muscle layers of the uterus, and we go into a lot more depth with this in class, but pulling against each other when women are in this state of fear, because there's these mixed messages going on with these inner circular muscles holding on to baby, but these longitudinal muscles over a period of time, they still want to get the baby out. The baby can't stay in there till it's a teenager. The body will work to draw open, and this is where you've got the 2 muscles working against each other. And so this causes tension in the body, which causes the pain of these muscles obviously pulling against each other. There's so you might have heard of Dr. Grantley Dick Reed, who really was the first one to discover this connection between fear and tension and pain. He was a doctor who really only attended medical births in hospitals, and over and over and over again, he would see women really having so much, really such a struggle with birth and being able to birth their babies and experiencing so much pain. And then one rainy night, he got called out to a woman who was in labor, and he went to her and he described this lady as a simple woman. And he went to her side and he said, you know, let me know when you would like the drugs. And she declined them, and she continued laboring, and she gave birth to her baby right there in front of him with no pain, in a really beautiful, calm way. And he couldn't believe what he was seeing. It was so different to the woman that, you know, in the hospitals and how they experience birth. And so he said to her afterwards, why didn't you want any of the medication? And she said to him, it wasn't supposed to hurt, was it, doctor? And so she didn't have the education that birth is painful. She obviously hadn't talked to any family members or seen any movies or, you know, had that influence from anywhere that birth was painful. And so he through his, you know, journey as a doctor, he really started to be curious about that experience, and compared to the woman who he was supporting through hospital births, what was this difference? And he really ended up realizing that the fear causes this tension, causes the pain. And again, it becomes the opposite of that calm response. It really shifts what's happening in a woman's mind, really shifts the way she experiences birth. And parents ask me, but what about the endorphins? Where are they when we need them the most? And the thing is, when we're in this state of fear, we've got the stress hormones running through our body, such as adrenaline and catecholamines, and they block the release of endorphins. Because let's say, you know, back in the day when a woman is birthing in nature, and if a tiger approached her, it's really good for her to have this defense mechanism kicking in. And she goes into that fight, flight, freeze mode. Her body holds on to the baby. She's able to defend herself against the tiger. Let's make it a happy story, happy ending. And so she, you know, maybe she bops the tiger on the nose, knocks the tiger out cold. I'm not really sure how you defend yourself against tigers, but let's just say that works. So then she's able to flee, run away back to her cave or back to her tribe. And then when she is safe again, the mind-body connection changes, and the mind says, okay, I'm safe now. She starts to breathe deeper again. Her body switches back to that calm state, that parasympathetic state in the body. And that's where the birth ends up being able to continue to unfold as nature has designed. So we need to have this endorphin blocking response in the body when we're in this defense mechanism, because if the tiger nibbled off the mum's toe while she was, you know, defending herself or something like that, she needs to know about it, that she's injured, so that she can attend to it and do something about it. So that's really that function of pain, isn't it? Is to have it's a little alarm bells, a little signal to say, pay attention to me, hello, help. So that's these two different ways of birthing. And it's great to have this defense mechanism if we really are in a situation where it's life-threatening. So if we do have a tiger approach us during birth, absolutely wonderful to be able to shut down the birth and have the best opportunity to save our lives and save our babies' lives. But the problem these days is not the tigers that come and try and eat our babies during birth. That sounds really bad, doesn't it? But thankfully, it's not really a threat to us these days. What the big threat to us now is the fear in the mind that women hold on to, because the mind doesn't differentiate between what is real or what is imagined. There's still this corresponding chemical and physical response. So the body still responds in the same way. So if a mum is just worried about, you know, replicating the same birthing experience as her best friend had that was really traumatic, or as her own mother had, or that she'd seen on One Born Every Minute or in Hollywood movies, or, you know, anything like this, where our fears so often come from. And so many times as well, women's fears about birth, they're actually not their own fears. They've come from listening to others' experiences of birth. So women, you know, and throughout our lives, we hear lots of different people's experiences of birth. And then we just, you know, we're listening to them and we take them on, and our mind registers, okay, remember that, remember that. The way the mind is designed is that it registers and remembers painful or potentially life-threatening things, or the negative things, if you like, so much more than the positive, happy things, because our mind has that innate kind of function of, if you're in this situation again, remember that this is a dangerous situation. So through hypnobirthing classes, we really aim to undo a lot of this pre-programming that women have had, and even, you know, dads as well. Dads have had experiences of listening to others around birth, and, you know, a lot of dads will talk to other dads about their birthing experience. And I love it when I hear that dads have talked to other hypnobirthing dads, and that, you know, they've had these really amazing empowered experiences, and they're like, it's the best. And because there really hasn't been a place for men or for dads as well in the birthing room, you know, for such a long period of time in our history. So men have forgotten their place in the birthing room, and it's such a beautiful time now that, you know, men can start to have so much more of a beautiful role to play in the birthing room and to support women. So it's about, you know, dads kind of, or partners, whoever the key support person is, it's about them just really having those tools to be able to support mum, and I teach those tools through the classes. So the way I share with parents is for the best way to prepare for their birthing day is in the same way as the way sports people, or sports professionals particularly, prepare for their big day, for their big event. So we never see sports professionals kind of sitting around and freaking out about their event and saying to themselves affirmations, you know, or just talking to themselves with this limiting self-talk, like, I can't do it. What if I fail? What if it's, you know, all these kind of doubts and fears. Sports professionals train their mind through visualization, through affirmations, through strengthening that mind-body connection. And they also train their bodies physically as well. So they know that, you know, that optimal physical way to have the best outcome on the day of their big event. And that's what parents also do as they prepare for birth. And it's really about that preparation for birth that makes the key difference. We can hear these things, or we can read books, or we can even come along to classes and learn about it. But when it's just a learning, when it's just a thinking, it doesn't usually translate as powerfully on the day of the birth as where women and parents have prepared and practiced together in the lead up to their birthing day. And so I'm going to be sharing some of the techniques that parents will commonly practice in preparation for birth in a minute. And there's so many beautiful spin-offs when parents prepare and practice these techniques during pregnancy. It supports bonding of parents. It gives dads, partners a role to play. They feel more bonded from early on with the babies, and they know their role. It's a real beautiful collaboration together with parents. It's not just this thing that women have to go through anymore. And also babies feel the beautiful effects of mum practicing these techniques as well, because of course babies are not just absorbing nutrients through the placenta. Babies are so aware and cognizant during their time in utero, and they are learning so much. In fact, neuroscientists believe that up to 50% of babies' personalities for life are developed during their time in utero. That's a lot, isn't it? 50%. Some parents are like, oh my God. But, I'm like, take the pressure off, just start now. And when parents can really spend that time during their pregnancy in relaxation, flooding their body with endorphins and oxytocin, babies are really experiencing that same thing as well. And they're also experiencing that same sense of calm. And typical hypnobirthing babies, after they're born, they sleep better, they have less cases of reflux, they're just more calm, happy babies. They smile from earlier on. So it's really, it's so beautiful for babies to experience these practices during pregnancy. The birth is just one day usually out of the whole of the baby's life. So there's this whole big picture as well to the benefits of these practices. And then of course, after the babies are born, mums will still return to these practices so that they can sleep, when baby sleeps. Everyone gives them that advice, sleep when baby sleeps. And with these techniques of being able to relax really quickly and deeply, they are able to be so much more calm in their parenting journey as well. So there's really 5 key steps for preparing the mind and the body for empowering birth. The first one is understanding how the body works. The next one is releasing subconscious birth fears and emotional blocks. The next one is feeling supported by her birthing partner and her medical team. The next one is practicing breathing and relaxation techniques to work with her body and her baby, and then also strengthening her mind to align her mind-body connection to be calm. So let's just very quickly look at some of these techniques in more detail. I share with parents how they can themselves identify the fears and then release them. So this is really how they can get rid of that metaphorical tiger that might come and visit them during their birth. And when parents are equipped with the tools to be able to identify what might be getting in the way, what might be coming up. So it's really a sense of self-awareness, and then that empowerment and that choice to choose how to shift it. And this is unfortunately what so many women don't have when they're birthing, is this ability. They can feel that they're scared, they feel that fear. Their conscious mind, so the fear sits in their subconscious, their conscious mind is saying, I want to birth this baby, I want it to be easy. They of course want to have a really great birth, but then if the subconscious is really holding on to that sense of fear, that's going to be the more dominant message to their bodies, and their bodies will hold on to the baby. So that's how fear translates during birth. So when parents have that ability to, during their pregnancies, I really encourage them to do most of this work during pregnancy, and then on the day, there might not hopefully be any fears that even come up for them. But if they've done a lot of that work, that self-awareness work, the fear release work during their pregnancies, then on the day, if it does come up, they still have that ability to be able to release the fear. And also their birth partners are also equipped with that ability to support mums to release the fear too. We've got breathing techniques. There's 3 different breathing techniques that people learn, that parents learn and that they're encouraged to use during birth. There's one breathing technique that allows them to really return to that optimal state of relaxation in between their surges, so during that rest period. This breathing technique is, so they're all really deep breathing techniques, but this beautiful breath that they use in between their surges, it activates the vagus nerve. And this is the nerve that really in the body really connects this mind-body. It is this mind-body connection. And when they can breathe deeply like this vagus nerve carries this breath, carries the sense of calm down into the body. It's connected with all of the major organs of the body. It slows the heart rate, lowers blood pressure, reduces inflammation, and allows mum to have this inner state of calm. So the breathing alone allows parents to experience this sense of calm. It's not just all mindset work. It's the combination of the physical technique and the mindset work that really creates the magic. And then parents learn a technique that they can use during a surge, which allows the muscles of the uterus to have lots of beautiful space to open freely in the perfect time for mums' bodies and for their babies. And this breath really allows mums to work with this physical unfolding and opening of the muscles of the uterus. And then there's a breath for birth as well. So this breath for birth allows mums to flow this energy down and through the core of their body and allow full relaxation, particularly of the birth path, when they do this breath, so that babies are allowed to move down and through in the perfect timing, the perfect way for babies. So this is as opposed to when we think of the word push, we tend to tense everything up and tighten everything up and hold our breath. And that can really cause a lot of restriction and tension around baby through that birth path. So instead, the breath that they learn to birth their babies really allows them to work with this downward flow, with the natural expulsive reflex, to really support the natural birthing ability of their body. And the number one thing that I hear from parents with regards to what worked the best when I speak to them after they've had their babies, I always ask, what was the best technique? And so often mums say that just being reminded to breathe was just so helpful for them, so powerful for them. So if you're a birth professional and you're supporting a hypnobirthing couple, if you just, talk to them about, what they would like, obviously beforehand, what they think would work, but if you guide them to breathe, if they've done their practice, they'll know exactly what that is and exactly how to work with their bodies and their babies. And then relaxation, of course, is just such a beautiful key as well. And the breathing helps with that relaxation. So we teach self-relaxation so that mums know how to relax themselves and get into that optimal state of self-relaxation. It takes away that element of the unknown, which means that it doesn't matter where mum is when she gives birth. She could be all by herself. She can feel confident that she knows how to get herself into the optimal state of relaxation. And, sometimes births do happen really fast. So for women to feel confident that they can be in that optimal state of relaxation themselves without relying on anybody else, it does give them a lot more confidence. We teach the partners techniques for relaxation as well. And then there's also audio tracks that layer in on top of that. And inherent in that is the facial relaxation, which sets the tone for the rest of the body. And we sometimes say loose face, loose fanny, as a little bit of a reminder for mums that, it's a good thing to do for birth. Visualisation is, of course, another really powerful way that parents plan and prepare for birth. Really very powerfully used with all of the top sports people. You always see them standing on the sidelines, running through in their minds and really getting into that zone mentally to prepare themselves for birth. And there's so much that happens when parents use visualization during their pregnancies to visualize how they're wanting to be as they're birthing their babies. And then also as well, visualizing what their body's doing, visualizing their body's opening, and really still being in that beautiful mind-body state of calm. And support is another beautiful layer that's included, in the course as well. Support from that birth partner, who becomes a really integral piece of the birthing journey. And then also how to work, and I encourage parents to work and collaborate with their medical team. So it's not us and them, it's a real beautiful collaboration of sharing their birthing wishes with their LMC, their key support people, asking lots of questions, and really everybody is working together for the same beautiful best outcome. So I have got some birth stories here that I've had prepared. I wasn't quite sure how long my presentation would be going for, but I'm not sure if I have actually got time to present them. Kathy, what do you think? Should we go to questions first?
Yeah, well, let's maybe just run a little bit over, and sorry. I think I've got my mouth's not working properly today. I would like to just throw in there a comment that as a self-employed midwife, when I was caseloading, hypnobirthing was absolutely consistently the most powerful tool I would ever witness of a woman taking control of managing the pain of their labor. It is just phenomenal. And so it's really preaching to the converted here, but it is amazing when those women get their minds into that right place. And I always talk about allowing the contractions to wash over you rather than take over you. I had to giggle when you were talking about the face, because I used to say to myself, relaxed face, relaxed vagina, and teaching them that when they're at home, in that establishing into labour, and there's not somebody around, their birth practitioner is not right there to sort of give them that little bit of advice along the way. They need to look in the mirror sometimes and see what's happening with their face when they're in the middle of a contraction or a surge, and really just go, oh, relax.
Yeah.
It's just amazing. Women have never ceased to amaze me how they will beautifully, stunningly surrender to what's happening with their body. They just let it go, and this look comes over their face that I call the goddess look, and where they are so calm, and they are so deeply meditatively within that labor and disconnecting from it but connected to it, and it is absolutely the most stunning look that comes over their face. And that's why I call it the goddess phase, when they get themselves into that calm place, and the byproduct is their cervix just opens up. Amazing to watch. So actually the questions that we have had come in, you've really answered, and so if anybody's got any other questions that they want to throw, go for it. But otherwise, what we might do is just wind it up in another few minutes, but let Claire to go through a couple of those beautiful real life case examples of women embracing hypnobirthing, or what I've often called meditative labor. I've tended to use that term meditative labor to women, because I think that especially sort of 10 or 12, 15, 20 years ago, saying the word hypnobirthing because Claire and I discussed this, didn't we, that there was almost this like hippie context to it, and women were almost a little bit resistant, you know, a decade ago, sort of going, oh, I'm not a hippie, so, and I don't want to hypnotize myself, I won't want to do that, so I'd call it meditative labor. But certainly now women are realizing that hypnobirthing is actually nothing new at all. It's how women have been dealing with the pain of labor for hundreds of thousands of millions of years, but we've now sort of understand it scientifically as to how that works with all our hormones and keeping us calm. Because if we can dial down, if we can get women to dial down their adrenaline and get that oxytocin dominating the labor, they feel the pain less, they dilate quicker, they birth more efficiently. And who needs an epidural when everything's just, you know, going so perfectly well? And yeah, so I will shut up and let give a few last minutes to Claire. Thank you so much for your wisdom and giving us that beautiful overview today. So you wind things up and give us a few little real examples. Thank you, Claire.
Beautiful. My absolute pleasure, Kathy. Thank you. So this is Rain's birth, and I love how she's really transformed her own previous experience of birth to be able to have this, she just had such a stunning experience. And I get this often. It's so powerful when women can, you know, have that experience themselves, and they're like, you know, I need to find a different way this time. And then they do, they really change their experience of birth around. So she says, I previously had a traumatic birth with my son born at 30 weeks and was terrified for the birth of my baby girl. Your classes changed everything. It was exactly how I envisioned, but better. I felt so prepared. And even at 35 weeks, when I felt it all begin, I was calm and ready. I woke up at about 3 a.m. feeling something happening. So I put on my favorite TV show and just enjoyed it. At about 3:30, I woke my husband up because things were progressing. We called the midwife and a friend to come over to be with our toddler, and we were off to the hospital. We got to the hospital at 4:30 and I was greeted by the hospital midwife, who was sure I just had a UTI because it didn't look like I was in labor. I could feel everything that was happening to my body, but there was no pain. I felt like I was in another world, and it was amazing. When my baby started making her way out, I didn't need to push at all because my body was doing everything. My beautiful baby girl, Rain, was born at 5:03 a.m. at a whopping 3.3 kgs at 35 weeks. I feel like a new woman after this whole experience. I can do anything. How cool is that? And this is Victor's birth.
So wonderful. It just summarizes it, doesn't it? What the woman will often say. Look, we have had a really an extra question come in, which is really great. It's so true.
Yeah.
And this is from, I get obviously a childbirth educator, prenatal teacher. So Christina, and her question is, one of the barriers I see often is women coming to my antenatal class having already been told by their midwife that they need to give birth at a hospital, just in case, or that their baby is big, so I need to go to the hospital, you know, just in case. It's that favorite sort of comment, in case anything goes wrong. I have to go to the hospital because it's my first baby, and my midwife thinks I should be there just in case, with a care team who seemingly are a little bit against them sometimes. How can they be calm and trusting? I'm going to throw in some comments in there myself as a midwife, coming from the midwife perspective of that. And I think that there is different levels of comfort zone within midwives' own practices as to whether they prefer to be in a hospital secondary setting, or whether they prefer to be in a primary care setting like a birth centre or a home birth. So definitely influencing it is that individual birth practitioner's comfort zone. And I think we have to respect that. You know, they are legally in charge of the well-being of two people, and where that midwife feels most confident and empowered and supported influences the birth. So, you know, that's an important part of it. So that's, I guess, where women are choosing the midwife that goes along with their sort of thought pattern as well, as to, you know, because there are women who will feel a lot more confident being in a hospital, especially with the first, but that doesn't mean she can't use hypnobirthing.
Yes.
And I guess that's the thing, is that from a midwife perspective, it is about getting that woman to that place where she is birthing in whatever environment makes her feel the most safest, empowered situation that works for her, but also realizing that just because she's in a hospital, it doesn't mean she needs to go and get an epidural and kiss goodbye to the process of having a hypnobirth meditation form of managing that pain of labor. However, on saying that, there's really strong evidence on research that shows that women who intentionally that we're talking about healthy normal women with healthy normal pregnancies, intentionally putting themselves into a primary setting where they don't have access to an epidural, statistically they have far better birth outcomes, because when women know they can't just say, yes, I'll have an epidural, and, you know, 10 minutes later an anaesthetist is putting a needle in their spine, when they don't have access to that, they manage the pain of their labor a lot better. So it is absolutely possible to have a beautiful meditative labor at a hospital. Claire, please add to that.
Yeah, I absolutely agree. These techniques are for birthing anywhere. So whether it's a home birth, whether it's a birth center birth, whether it's the side of the road, well, it's, you know, kind of hope not for most parents, but, you know, whether it's in hospital, even for parents who end up having cesarean births, they still use these techniques, because it's not, in the end, it doesn't really matter as much how baby enters the world, and matters how parents are bringing themselves to the birth. So parents can always bring those innate faculties of love and connection and breath to any kind of birth experience. But the real key here is,
and actually I'll add one more comment in there, because that the question specifically commented about the large babies. Now, it has certainly frustrated me as a midwife over the years, where women have had ultrasound scans, and the radiographer or sonographer has made a comment along the lines of, you know, something like, gee, your baby's a good size, isn't it? And what that can do is put fear into women that they have this huge baby. And these days, with growth charts, the midwives, of course, and obstetricians are using customized growth charts, which are based around that woman's BMI, her height, her weight, her ethnicity, etc., any weights of previous babies. So it is, we can be, you know, fairly accurate on knowing whether that baby is categorized as being technically macrosomic or large for dates. And if the baby is large for dates, then again we have to let some common sense prevail. So a baby who is large for its gestation at, say, 37 weeks is a good size for its gestation, but it probably is not large for dates for that woman, because we need to look at her and say, well, large for dates goes right up until 42 weeks. So if we followed that growth chart up to 42 weeks, is this a large for dates baby for this woman in her size of her body. And usually a large for dates baby at 37 weeks is not too large for that woman. Whereas if you had a baby who was large for dates or macrosomic and it's 41 weeks, well, yeah, you probably do want to be in a secondary care facility, because you've got increased risk of shoulder dystocia, and you'd want those extra pair of hands around you. So it's kind of using that somewhat common sense, but certainly a really frustrating thing is when a woman is told that her baby is a bit chunky or a bit chubby or is a good size, those sorts of comments, but it's not actually macrosomic. And, you know, the normal weight for a baby at birth at term is anywhere from 2.5 kilos to 4.5 kilos. So anywhere in between there is normal. So, you know, your baby might be measuring about 4 kilos, but actually that's normal. It's a chunky baby. Great. It's going to be a good feeder when it arrives. It's going to be really nice and robust. And perhaps on the other end of the spectrum, it's when we've got babies who are very little for their size. You know, if they're small for their dates, then there is another reason that you would want to be in a secondary care facility. So when you've got women as a childbirth educator and they're saying, oh yeah, I've been told my baby's, you know, quite a big size and I should probably be in the hospital. What I would recommend you saying to the woman is to empowering them and saying, have you been told your baby is officially large for dates? You know, is this a diagnosis? If it's just a bit chubby and it's, you know, it's robust, that's great. That's no reason to be in a hospital for a healthy, normal pregnancy.
That's spot on. Asking those questions is just key. So parents, you know, for parents not to be shy to ask lots and lots of questions. If parents can go into it knowing, okay, we know exactly what's happening, because that can be a real disconnect, I think, sometimes, where they hear these words and they hear this language like big baby, and then they have fear around big baby because they've heard maybe stories. But if they actually ask those questions, confident themselves at exactly what is, and even more reason to be relaxed in birth if you do have a bigger baby. Because, you know, it allows your body to open up so much more easily.
Yeah, and also we must wind this up, but also another comment I'd add there is that you know, we all know that the toughest part of the baby in general to get out is the head. And, you know, after that, you know, we can have tight shoulders, but, you know, the head is the first bit, you know, that is the tough bit. And head circumference and weight is two different things on a baby. And, you know, I always say to women, my baby that had the largest head circumference had the smallest weight. So, you know, it doesn't always relate. And, but anyway,
and
we're going to wind it up. Any other last things you want to add?
Yes, well, hopefully some of you have had a chance to read this beautiful birth story, so I won't read it out to you, but this last slide that I just want to leave you with. So what if having a safe, calm and comfortable and empowering birth can be a woman's rite of passage into motherhood? When I was first pregnant and I was hearing all these things about birth and learning so much, pain is just a rite of passage into motherhood and birth. And I was like, oh, really? That sucks. But it didn't have to be. And I didn't experience pain in either of my births, and a lot of women don't. And so having this sense of calm and confidence and empowerment, what a beautiful rite of passage into motherhood that can be for parents. So you're in birth educators, professionals. Yeah.
And when women have given birth naturally, it is a sense of pride that they never, ever, ever lose. And it's not to say that, you know, if for whatever medical reason you need to have a cesarean and that woman can't give birth naturally, it doesn't make it less of a mother or anything like that. but there is still, it's, you know, I guess it's a little bit like you know, if you do the New York Marathon, are you proud? Yes. Will you always have that pride? Yes. You know, so there's an accomplishment within it, that it's a pride that you never lose. And there is a bond between women as well. And it really doesn't matter if you're 17 or 37 or 57 or 97. You get those women all in one room together, discussing the fact that they've all given birth. And they all relate, they all understand that what they went through, and they never lose their pride, never.
Yeah.
Never. Yeah. And it's a big deal, and we should be it makes a lot of empowerment to those women, that's for sure. Anyway, look, love you and leave you, everybody. Thank you very much for joining this IMCO Natural Maternity Health symposium webinar today. And we hope to see you next week, same time, same place, and with another wonderful speaker. And have a lovely week, everybody. Thank you very much.
Lots of love, everybody. Thank
Bye.
you. Thanks.